Hey everybody, you just pushed a baby out, or maybe you had a C-section, but this is very similar for vaginal delivery or C-section delivery. So after you have your baby, the doctor will help remove the placenta, but you might need to do like a quick little push to get the placenta out. And it kind of just comes out, feels like a big blob. Immediately after, assuming this is okay with you as the patient, we typically run Pitocin through your IV. This helps to stimulate contractions. It helps the uterus to involute or to shrink. We want it to shrink back to normal size eventually. That takes several weeks, but immediately after you deliver your baby, like, we want to get this started right away. If you had a laceration or any kind of tear, the doctor will be suturing you, a midwife will be suturing you, and you might have your baby on your chest, skin to skin, or maybe baby is on the warmer and the nurses or respiratory therapists are making sure everything's okay with the baby. Your immediate postpartum recovery period begins. Next, the nurse will massage your fundus, not fungus, your fundus, which is the top of the uterus on your belly. Let's see if I can show you. So usually right after delivery, your uterus is like right where your belly button is, the top of your uterus. And we massage that area to, again, help with expelling any blood that might be inside and make sure that the uterus is staying firm and in the center of the abdomen, midline, and also like at umbilicus, your belly button, or below. We want to feel it shrinking. We're massaging it to make sure it's firm, because if it's boggy or soft, that's a sign to us that something's going wrong. Your uterus isn't contracting the way that it needs to be, and we need to take action to help you with that. It's really uncomfortable, but just know that it's for us to keep you safe and make sure that you're recovering well immediately after delivery. We also check bleeding on your pad right after delivery and every 15 minutes for about an hour, sometimes longer, just to make sure that you're doing okay. We'll check your vital signs, blood pressure, your pulse, make sure that your temperature is normal, and just overall your appearance. And if you had an epidural, it should be off by now. This is usually a good time to eat a snack, drink fluids. It's like the best drink and snack that you've ever had after you've given birth. It's just like, yes, your golden hour with your baby. So that's the time that skin to skin is so important. Attempting to breastfeed for the first time. You have colostrum in the beginning, which is that liquid gold. So nutritious for baby. It has those enzymes and growth hormones and all the stuff packed like into a couple drops, and that's all your baby will get and all your baby needs in the first couple days before your mature milk comes in. If you're not able to have skin to skin with your baby right away and attempt to breastfeed within the first hour, like say your baby is being attended to by the NICU team, or maybe even has to go to the NICU for observation, or being admitted to the NICU for some reason, it doesn't mean that trying to breastfeed is totally over for you. This is the perfect time for you to massage your breasts and get the stimulation that you need to send the signal to your brain, oh, I need to be making milk for my baby right now. So you can save that colostrum in a little cup, bring it to your baby later, or even if it's just the baby is right next to you at the warmer but not skin to skin, massaging your breast within the first hour. Any stimulation, breast massage, or attempting to breastfeed in the first hour is key for establishing a good milk supply. A couple other things that happen before you are transferred to the postpartum unit. If you did have an epidural, we remove like all the tape that's taping in the catheter, and then we remove the catheter. We help you to empty your bladder. Either we help you get up to go to the bathroom and you can pee in the toilet like normal, or if you're still feeling weak from the epidural and not comfortable standing and walking to the bathroom, we can put in a catheter to help drain the urine as well, because draining the bladder helps the uterus to involute. We'll show you how to use the peri bottle or your squirt bottle to clean yourself well from blood, and then just dabbing with toilet paper you don't want to wipe, especially if you have sutures. And then we'll put on a fresh pad. We'll help you get to the wheelchair and wheel you over to postpartum with your baby and your stuff. This is very similar. If you had a C-section, we would be massaging your fundus every 15 minutes, but for 2 hours instead of 1 hour, and giving you pain medication if you're in pain after your surgery, and changing your pad. You already have a catheter in place from going into surgery, and we leave that in place, and then they'll remove it in postpartum several hours after your surgery. Then instead of being in a wheelchair, you would be wheeled over in the gurney to the postpartum unit, and you are still able to breastfeed as well, all those same things. That is a little summary of the immediate postpartum recovery period. Thanks.